Hey, my friend, Dr. Lee Warren here, and I'm grateful to be back with you for another episode of the Self Brain Surgery Podcast. Today is a special science spotlight episode with my friend, Dr. Gena Nikitin. Gena is a biochemist who's Russian but lives in Norway, and he has started a new company called Miphic that's involved in what we call precision medicine. And I wanted to talk to Gena because I want you to know what's coming in medicine and science. There's some exciting things happening, and biochemistry is kind of leading the way, which I'm excited about because I'm a biochemist by training before I went to medical school. But Gena's going to talk about what precision medicine is. This is the idea that certain lab tests can determine whether you're a good candidate for a particular drug or whether a particular cancer might respond to a particular type of therapy or not, based on the unique features of an individual patient, rather than does this drug have some activity against cancer or not? Does it have activity against your cancer? Does it have activity against your issue? Or would you be a good candidate for it based on your biochemical profile? So precision medicine is this process by which we can determine how an individual patient might best be treated for a given disease or disorder, or maybe screening for certain things being likely or not, or maybe even someday preventing certain diseases from happening. So Gena's going to talk about mitochondria and what they are and what precision medicine is. And then we had this wonderful kind of short philosophical conversation about science in general and what it is and what it's not. And you've heard me talk a lot about science over the years. And in my new book, I go a lot into what science really is and what it's not, and what it can and can't do, and what it's designed for and what it isn't designed for, and maybe some surprising information about what faith and science have to do with one another, as we talk about on this show a lot. So I want to introduce you to my friend Gena Nikitin. He's a fascinating, brilliant man. We have a little bit of talk about faith in this episode, and I think Gena and I'll talk more about that in a future episode. He's got an interesting faith journey and a really powerful and fascinating story, and a person who's living out his passion, lifelong passion for making the world a better place through science. So I want to introduce you to my friend, Gena Nikitin, and I'll come back and talk more at the end. Let's get after it. Friend, we're back. I'm so excited to be introducing you to a new friend. I've had such an amazing exchange of emails and getting to know him, and really brilliant scientist currently living in Norway. I've got Dr. Gena Nikitin with me today. Welcome to the show, Gena.
Yeah, I'm really happy to be here.
You reached out to me through your company, Miphic, a few months ago, and we had some conversations, and we're going to talk all about mitochondria and precision medicine and all kinds of fun things today. But I've really enjoyed our interactions with each other, and just grateful for your time today, my friend.
Thank you, Lee. I'm really happy to have a friend like you. It was an amazing set of conversations which we had in private, and I'm looking forward to continue them for a very long time. Thank you.
Me too. Well, tell us a little bit about yourself, just a quick introduction, overview of your life for the listeners here, since they haven't met you before.
Yeah, so I suppose I probably don't have the most common background because I've been born in Russia, in one of the most poverty-stricken parts of Russia. All I can say in short about my life in Russia that I have zero good memories from my childhood. Always wanted to leave the environment which I was born into. That's why from the basically the first years that I can remember myself, I was really dreaming to become a scientist, to make a positive contribution to humanity. So I studied on my own pretty hard. I was winner of different Olympiads in chemistry, biology, also on the national level. Was able to graduate from the best university in country, and then I went to Switzerland to do my PhD. And I spent 7 years in Switzerland, developed first version of our technology. Moved to Norway almost 6 years ago, where I was able to implement my technology for the first time in the real-world clinical samples. About 2.5 years ago, I started a company, an independent company, and now we're ready to soon, hopefully, enter the real world with our technology. That's my dream.
That's exciting. Now, what do you think was the impetus for science? What made you interested in science?
Well, I suppose I'm not the most, I suppose I'm not the most, usual human being. So I remember that I've been called a child not from this world in my childhood. So, because I was always interested in something big, and how the universe works, how the nature works, not how the petty human fights, work and how to win them and stuff like this. So, this is why I was just constantly curious, and I am right now constantly curious about new things. All my free time is essentially being spent on reading books, watching new educational lectures. For example, now I'm following economics a lot, but I also like studying physics on my own. I try to catch up on math as well. And that's how basically I became a scientist. I always believed in the power of human intellect and that we can do so much good if we, direct our intellect into the good cause. And yes, and I believe that I could contribute to this goal personally as well, and that's what I'm trying to do with my life. I don't know how well does it answer your question, but yes, at least I guess I tried to explain how I came to science. Yeah.
It's exciting. And what particularly about biochemistry, molecular biology was interesting to you?
Yeah, that's actually a very interesting question and maybe an interesting story. So initially, I was for the most part interested in chemistry because, as a child, I was so interested in the chemical reactions, especially in the fleshy ones, and that you can transform one type of matter into another and see basically how the properties of matter change. But yes, and that's why I graduated initially as a master student in organic chemistry. And actually, a big part of my scientific work was dedicated to organic synthesis. But during my PhD in Switzerland, I realized that I wanted to have a more direct impact on real life and to help people in the real world. And that would actually involve medicine and biology rather than doing some synthesis of compounds which some other people could implement in some way, but I wanted to have a more direct impact on that, and that's why I switched from chemistry as the main part of my scientific work to, let's say, biology and applied basically bioimaging and so forth. That's how I came to biology. While initially I was for the most part interested in chemistry.
So I grew up wanting to be a doctor. So you had this strong sense of wanting to help people with science. I did too, but I saw it from my very early years as wanting to pursue medicine. But in college, it really became fascinated with biochemistry. So my undergraduate training was all in biochemistry, and I spent 2 years in a laboratory working in biochemical reactions and studying autoimmune diseases and how we could figure out what was going on with them at the biochemical level. So I think we've had interesting kind of diverse ways to get to a similar set of interests. But so talk about for a moment. So at some point during your training and your education, you got interested in mitochondria. So for the listener, now it's not a science podcast for the most part. We talk about neuroscience a lot, but there may be some people that don't know what mitochondria are or what they do. So we talk about that a little bit and why you're interested in mitochondria in particular.
Yeah, so that was for the most part a moral choice and let's say desire to do something big with my life choice, because mitochondria are the reason why we must breathe oxygen. And if our listeners don't know, mitochondria are the only reason why we evolved lungs. We would not need lungs for any other reason other than optimizing the delivery of oxygen to mitochondria. And yet I realized during the beginning of my PhD in Switzerland that we ignore this function. Why we must breathe oxygen as like human biological beings, we must breathe oxygen. And yet we have zero access to analysis of this function, diagnostics of this function in the real world. And then I realized that if I would be able to contribute to this problem being solved, that would mean that I did something very significant with my life in terms of contributing to the advance of medicine for people worldwide. And that's how I became very passionate. And that's how we now already decade plus in mitochondrial world.
So mitochondria, the listener understands, we've talked a little bit about it, is the cellular, the battery organ that allows us to have energy in our cells. And there's no lab test to tell us how our mitochondria are working. Right. And a lot of medicine is creating chemicals that act on cells. We don't always even understand the full extent of how they work. And you're giving us an opportunity to investigate the role of mitochondria and the response of mitochondria in particular ways. So unpack a little bit what it is exactly that this lab test that you've designed and invented does and why it may hold some hope for certain human disease.
Yeah. So in short, analyze mitochondrial battery charge. If we simplify things, how well mitochondria produce energy in each particular cell of our body. And then we first measure the battery charge as it is. So in the current situation, disease or healthy condition, and how it differs between different cells. But then we also start challenging this charge with different metabolic tests. For example, we give a cell high glucose or high fatty acid diet, so a lot of lipids, or we inhibit certain mitochondrial enzymes, and then we see, does this charge change? Is it sensitive to certain metabolic stimulus or certain metabolic inhibitor or not? And having these responses in different cells, we analyze a very complex picture of how different cells in our bodies use mitochondria in regard to sensitivity to these different metabolites or different inhibitors. And we have hundreds of thousands or millions of data points which we generate in one test. And then we use all of this complex information to implement essentially mathematical modeling. So let's call it machine learning or artificial intelligence, if you like. Now it's pretty fashionable to call it like this. And we use the modern data analysis methods to link this complex information to the real life outcomes which happen in the real world. And ultimately, what we are doing is we're trying to develop a very robust and reproducible and also cost-efficient test so that we can analyze this mitochondrial function in all its complexity in real world in a real world setting, and then give a reliable prediction that, for example, I, Gena, should be given this drug in my disease because that almost certainly would improve my mitochondrial function and improve health outcomes for me, while the same drug would not be equally efficient for other person who has different mitochondrial profile. And that's what we do. We basically link now mitochondrial function to the real life health outcomes.
So effectively, let's use an example of somebody with leukemia or lymphoma or some kind of blood cancer. You theoretically may be able at some point to say this particular chemotherapy drug will not help this particular patient, or is likely to help this other patient more because of its effect, because of their baseline mitochondrial function and its effect on mitochondria. Is that right?
Yes, it is correct. Essentially, we are focusing on leukemia and blood cancers initially because this is the space in which mitochondria and metabolism are already being targeted as the best possible treatment on average. So, for example, the breakthrough in survival for acute myeloid leukemia patients came with the drugs such as venetoclax, olutasidenib, ivosidenib, and enasidenib, which target mitochondrial or metabolic pathways, and just it happened within the recent few years. The problem is that if you are a responder to this drug, you greatly benefit in terms of survival and quality of life. However, if you're non-responder, you only suffer from side effects and also pay a huge amount of money for the treatment that gives you nothing but side effects and potentially kills you faster. But since we basically now demonstrated that yes, we can distinguish how mitochondria work differently, how metabolism is wired differently in different patients, and we can reliably distinguish this now, we're using this information to explain and predict why certain drugs give such beneficial effects for some patients while only hurting others. So that in the future, we don't have to spend hundreds of thousands of dollars to only provide patients side effects, but we actually can reliably pick the best possible available treatment for each patient with this blood cancer, in this blood cancer space, to optimize both healthcare costs and increase the survival rates and the quality of life for patients worldwide. Yeah.
That could eventually apply to all kinds of diseases and all kinds of medication classes. I mean, there's really fascinating. The first time we talked, it was kind of a business call where I was learning about your company, and basically the potential utility and use case for your assay, your testing, is so fascinating because it could really go across just about every aspect of human medicine.
Absolutely, yes. Of course, blood cancers are only the market entry point for us because we're already now starting new projects for autoimmune diseases. And if you're interested, we're essentially trying to give a robust profiling of immune cell metabolism in patient bodies. So how different types of immune cells, such as granulocytes, lymphocytes, and monocytes, are wired different metabolically. And then we compare how this metabolism differs in a healthy patient, in a healthy control person versus the autoimmune disease patient, so that we can now discover what metabolic shift in which immune cell type is responsible for this crazy situation when immune cells start attacking our own bodies and produce huge amount of basically problems for a patient, so that we can specifically target these metabolic shifts in a particular cell type in the future and really deliver this value of precision medicine to everyone.
That's fascinating. So it may not be just who's going to better benefit from this drug A or drug B, but it may eventually lead to very tailored, novel therapeutic approaches to patients with different types of diseases. I think that's really exciting to me as an old biochemist from back in the day. Like, to think the idea that somebody with something like lupus or rheumatoid arthritis or something may be a potentially treatable based on their mitochondrial profile that nobody ever thought about before. It's really fascinating, groundbreaking work, Gena. And I'm really grateful to know you at the beginning of this, because I have a very good feeling that you're going to be one of these guys that your lab test is run in every lab in the world one of these days. And we pray that that's a good outcome for you in that regard. You're doing really remarkable work, and I'm proud of you. But another reason I wanted to talk to you today, not that you need me to be proud of you, but I'm so fascinated by what you're doing. But another reason I wanted to talk to you is because in our email interactions back and forth, we had some conversations about science in general and why science is so great, and what its limitations are, and what its purpose is. And I think this will be fascinating to these listeners. Most of the listeners of this podcast are interested in neuroscience and interested in faith, and many of them have been through hard things. We lost a son 12 years ago, and a lot of people have been through difficulties. Sounds like had some real significant difficulties in your childhood, and yet as an adult, you're a very hopeful, optimistic person and trying to make a difference in the world. Like, maybe just from your perspective, like, talk for a moment about what you think is the reason why, with the upbringing and background that you had, that you're an optimistic and hopeful person. Like, what are the things that made you that way? Because you easily could be a bitter, angry person, or a person who's not hopeful or happy. So what sets you apart? How did you make that journey?
Yeah, so just to be completely transparent and honest, I have to confess, I struggle with bitterness and sadness and challenges of essentially keeping going despite all of the calamities all the time. It's just that this is the story of my life. I'm a stubborn person. I refuse to be broken, refuse to give up. That's, yes, just to be clear, I do not want to lie and create an impression that I'm some kind of like strongest person ever, that I don't have challenges. And
important. That's so important that you have that insight, and because everybody's that way, Gena. Like, nobody is without some bitterness or some fear or some worry and all those things, and yet you have this drive to continue going. So I just wanted to hear that, like, what makes you tick in that regard.
Yeah, and that is because I guess from the time I remember myself, always had this, again, stubborn refusal to accept evil, which I consider to be, evil tendencies in the world and evil actions. And I wanted to believe that it's up to us to create a better world, a better universe, to really not let everything to become essentially the entropy-driven universal decline when everything is basically dying, getting worse all the time. And this is essentially the question of morality for me. I wanted from my childhood not to be a person who beats others, abuses others, threatens, uses power to extort things, and all of this stuff, because in reality, I believe we are human beings and we have such a great potential to advance something beyond the pure materialism, like just a constant trying to get a minimal resistant path and so forth. And this is essentially also because I was always believing in God, because again, this is how I link my moral drive from the childhood to make this difference. Because if I would be driven by completely egoistic, materialistic things, I would have chosen different path a million times in my life. And again, that's honestly makes me much more, let's say, satisfied in my life, because I don't need to depend on someone to provide me a lot of money or a lot of whatever physical pleasure to feel that my life matters and that I matter. I'm actually shifting this particular question of whether or not I am living for something rather than just trying to postpone death and then just complete nothingness after it. I'm basically giving myself a power and responsibility to make my life matter and to leave an hopefully eternally good mark with my life. This is how everything essentially in my life story and essentially business story, I would say, and Miphic as well, is developing so far. I want my life not to be dependent on some accidental external factors. I want to make an impact, which is driven by my decisions and not basically to try to find an excuse or justification why I also became corrupt and whatnot. Again, given saying all that, I want to be completely honest and clear. It doesn't mean that I don't have the same challenges and same basically difficult questions every day of choosing basically how to provide, the bread on the table, how to pay the bills as everyone else. And I understand how difficult that is. And no matter how much you try, you cannot be perfect. So I just try to do my best. This is what I would say.
Yeah, well, I love it. And I think it's very good to acknowledge the fact to be a rational person, an honest person with integrity. Nobody's without all those issues, fears and frustrations and all of that. So you and I have had a little bit of a conversation a couple of times via email about faith and God, and I know you're reading my work, so you know where I come from as a Christian and a scientist. And you said something fascinating to me about science, rather than, I think what a lot of lay people especially think that science is this discovery of truth and discovery of what's real and all of that. But that's not what really science is. Like, unpack that from your perspective, and this line that you gave me that I've completely stolen now about becoming less wrong over time. I love that. So just discuss science and what science is and what it's not for a minute.
Yeah, absolutely. So, I guess this line, what you mean is that I truly believe that science is not about becoming right. It's actually becoming less wrong. That's what true science is to me, not pretending that we can get an absolute level of knowledge. And this is what I mean by that. If science would be the absolute level of knowledge, then it would immediately mean that there is absolute ceiling of what could be achieved. That's one thing. But also it would mean that if current level of scientific knowledge is actually the absolute truth and absolutely correct state of matters, that would mean that we practically exhausted our capability to make a change for the better, to advance humanity, the universe and so forth. And this is, again, I refuse to accept, because I believe that we can do so much better that we are currently doing with this world. And this is why, for me, science is a tool. It's a tool. It's not an absolute truth. It's not an absolute power. It's just actually a very useful, pragmatic tool with which we can make big difference for moral purposes. For example, save a child from dying from a disease which would be incurable before, or something like this. That is an extremely useful tool. But I never forget that this is a tool, and our scientific knowledge is always a model. In fact, Newton was completely acknowledging that his theory had complete, basically, limitations, and he could not explain everything. And as you probably know very well, Newton, in fact, was a Christian.
Yeah.
So that's why, to me, there is never a dichotomy between being Christian and being a scientist. It's just that unless you try to turn science into a religion, you're completely fine that it has limitations. It has its uses, and if you're pragmatic and acknowledge your own fallibility and inability to do everything correct, you just basically use what works to the extent it works right now, while constantly trying to improve it, go better, and essentially advance science by becoming less wrong. But maybe to finish this tirade is that For me, one of the most important things of advancing science and becoming less wrong is to remember that we can and most certainly are wrong right now. Not trying to desperately cling to the current state of knowledge and not admitting that it could be wrong. For me, this is one of the most important traits of true scientists, and that is to be able to admit when you're wrong and advance yourself and progress further.
That's exactly right, and I think that's a brilliant insight, especially for such a young guy, because if you think about it, scientists at every age, in every era, have thought that they understood something completely or nearly so. And yet, all of us would easily be able to say that almost nothing that we thought was true 50 years ago, we still think is true. And so, in the same breath, right, we understand molecular and cellular biology and the information in DNA at a far greater level than Watson and Crick did, but they thought they understood a lot. And we understand gravity and relativity a lot more than even Einstein and the early quantum physicists did. And yet they thought they all knew so much. So everybody that thinks they know something, as the Bible says, the wise become fools over time. So I think the process of science and seeing it as a tool rather than as an ultimate search for truth is the right way to look at it, because what science really does is gives us a method for investigating what's more true than what we know right now, or less true than what we know. We can discover that on either side. So I have, like I said, I have license to your phrase, and I'm using it widely. I always give you credit for it, but I love that, and I think what'll be interesting. Hopefully, we'll have another conversation down the road, Gena, as we explore science and faith and their interactions together. I think it'll be interesting to see where our friendship leads us, because we're having good conversations and asking good questions. And I love the relationship. And we're praying that your company has great success, that you achieve your mission of making the world a better place for people. And I'm grateful to call you friend and for the time that we've had to talk about mitochondria and science and life together today.
Thank you, Lee. I cannot express my gratitude well enough. I'm definitely looking forward to our conversations in the future. And yes, and if anything, I can just add from my personal, view to our viewers is that we should always basically look forward and stay optimistic, because no matter how difficult the times can be or how challenging the life events can seem to us, in reality, we can do so much more. We are always trying to scare ourselves that we can. And for Miphic, this is what I repeat myself. This is probably, everyone knows, one of the most challenging startup times in many years. But that's what I'm saying. For me, it's a question, how much do I truly need it? And if I really need it as much as I claim, and as I believe I do, I will find a way. There is a way to advance it, because ultimately, from again scientific logical point of view, there is absolutely no way that this fundamental function of our bodies, why we must breathe oxygen, could not find a huge economical benefit in the real world once it's been enabled in terms of diagnosing and targeting in a correct way. So it's only the matter of resilience, dedication, yes, and staying on a good path from a moral point of view for me. And I'm sure we will all benefit from mitochondrial precision medicine, hopefully not so long from now.
That's exactly right, and I think you're going to do it. I'm very impressed with the science. I'm impressed with you and the team members that I got to meet, and I'm grateful that you took some time to all the way from Norway to spend a few minutes with us today. Hope we can do it again someday, my friend.
Absolutely. Thank you, Lee. Thank you, our listeners. Yeah. God bless.
What a fascinating conversation. Gena's a brilliant young man, as you can tell. I have high hopes that Miphic is going to make a difference in the world of screening and precision medicine. And I just wanted you to be aware that there are really smart people working on things from interesting angles all around medicine. And where science and biochemistry and medicine come together, there's some fascinating and really miraculous things on the horizon. It's Miracle May. And someday we may be able to say, hey, this particular drug is going to cure cancer in this particular individual patient, even if it didn't work for 1,000 other people. And it might be something like that comes along because of the hard work of people like Gena. I think there's a lot to be said about science, and what we learned today from Gena is this idea that science is really not ever about finding out what's true. It's about becoming progressively less wrong about what we think about how the world works. And when we get down to looking at what God has done and how God did it, we're only going to ever find the real truth once he reveals it to us. And science is this process of incrementally getting a little bit less wrong about the questions we're asking and the methods that we're using to determine how to look at those questions. And so I thought it was a fascinating conversation. I hope it was helpful to you. I'm sure we'll hear more from Dr. Gena Nikitin down the road, and I'll put links in the show notes if you want to learn more about Miphic and precision medicine and Gena's work. Don't forget to subscribe to the podcast wherever you listen. Be sure and sign up and leave a rating and review. It really helps other people to find out about the show. Be sure and sign up for the newsletter every Sunday. Since 2014, I've brought you my best prescriptions for how you can change your mind and change your life at the intersection of neuroscience and faith. It's drleewarren.substack.com, drleewarren.substack.com. Make sure you're signed up so you don't miss anything, because the podcast is only part of the great work that we're doing on your behalf every week. Friend, hey, don't forget, science and faith are not enemies. In fact, science best applied is when you put it in the context of how we're really designed. And when you smash together faith and neuroscience, you really can overcome just about anything. You can become more resilient. You can become more robust. You can make progress again after life sweeps your feet out from under you. And you can overcome trauma and tragedy and any kind of massive thing. I'm Dr. Lee Warren, and I'm so grateful for the time that you spent with us this week. I'm grateful for Dr. Nikitin's time. And we'll see you next time. But don't forget, you can't change your life until you change your mind. And the good news is you can start today.